Maybe if you spent less time playing doctor and more time changing bedpans, you'd remember your place. That is what Dr. Whitfield said 14 minutes before the Special Forces operator in bed 12 coded. He had no idea who he was standing next to. Neither did anyone else. Katie Morrison moved through the fluorescent-lit ICU corridors of Seattle General in Atlanta with the efficiency of someone who had learned to be invisible. Her scrubs were perfectly pressed. Her dark hair pulled back so tight it seemed to stretch time itself. No jewelry except a simple watch with a cracked face, the crystal shattered in Helmand Province, the second hand still keeping perfect time. The night shift hummed around her. Ventilators wheezed their mechanical rhythm. Cardiac monitors beeped their steady metronome. The smell of antiseptic hung over everything like a pharmaceutical fog, cutting through the copper undertone of blood and the organic decay that no amount of bleach could fully erase. Katie moved through it all without flinching. Pain was information. Suffering was just data waiting to be read. In her locker sat a pair of worn combat boots. She touched them every shift before closing the door. Desert tan leather, cracked at the seams, the soles worn thin from 17 years of walking ground that had tried to kill her. That was how many years ago? She didn't count anymore. The mission that swallowed those boots had also swallowed the woman who wore them. Katie Morrison was the replacement. A cover identity built from nothing, a nurse who asked the right questions and made no enemies, until Dr. Whitfield decided she was worth making one. She had a slight limp favoring her left leg. 3 parallel scars visible on her forearm when she reached for supplies, thin white lines that looked like they came from a car accident rather than shrapnel. The story she told, if anyone asked, was a motorcycle crash in her 20s. Nobody asked. They looked at the scars and then looked away. They never looked at her hands. Her hands were the problem. Steady. Certain. The kind of hands that had held lives together in conditions where you couldn't afford to shake. The kind of hands that knew exactly where a central line needed to go because muscle memory never forgot, because the supply closet at FOB Shank and the supply closet at Seattle General both held the same essential tools, and Katie's body understood the difference between civilian medicine and the kind you practiced when the only alternative was letting people die. She reviewed a chart at the nurse's station at 11:46 p.m., her pen moving quickly across medication reconciliation forms. Floor 3 was quiet tonight. 12 beds. 9 occupied. 2 stable. 1 unstable. One that hadn't opened his eyes in 72 hours, a Special Forces captain with a collapsed left lung and a sternotomy incision that was healing too slowly for comfort. Dr. Whitfield arrived for evening rounds at 12:38 p.m. exactly. His white coat was crisp. His voice carried across the unit like a scalpel, cutting through the ambient noise of machines and monitors. He discussed his campaign for department chair with 2 residents flanking him, eager young men who nodded at every observation, laughed at every joke, performed the small rituals of hierarchy that the hospital demanded. His voice was the voice of a man who had never been questioned and believed he never would be. He noticed Katie reviewing the chart at the nurse's station. His eyes narrowed. She was the one who questioned his antibiotic choice on the pneumonia patient last week. The one who suggested, quietly, respectfully, with the demeanor of someone simply raising a clinical concern, that the fluoroquinolone dose might be unnecessarily aggressive given the patient's renal function. He had dismissed her with a tight smile and ordered the full dose anyway. The patient's creatinine had spiked. Katie never said "I told you so." That wasn't her style. Katie felt his presence before she heard his footsteps. The way the air pressure changed. The subtle shift in the room's attention. She did not look up from her charting. Her jaw tightened almost imperceptibly. Nobody would have noticed. Only someone trained to read the smallest muscular contractions, someone who had learned that flinching in the wrong moment meant death, would have seen the microscopic tension at her temples, the brief tightening at the corners of her mouth. "Evening, Katie," Dr. Whitfield said. His voice was pleasant. Too pleasant. The tone of a man who had decided something and was simply executing on it. "Staying late." She looked up. Met his eyes for exactly 2 seconds, long enough to be respectful, short enough to avoid challenge. Finishing the medication audit for beds 8 through 12, Dr. Conscientious. He smiled. The smile of a wolf showing its teeth. Though I've noticed you spend rather a lot of time on the details. Chart audits. Drug calculations. Second-guessing treatment plans. Katie set her pen down. She did not set it down hard. It made no sound. I want to make sure we're not missing anything. That's admirable, Dr. Whitfield said. He glanced back at the residents. They were watching now. This was theater. He was performing, and Katie was the stage. But sometimes attention to detail can become, how should I say, presumptuous. You're a skilled nurse, Katie. Really? But there's a reason we have physicians, and there's a reason we have nursing staff. The hierarchy exists for a reason. Katie felt the words land like shrapnel. Tiny, precise, designed to cut. She had taken worse. She had taken rounds from a PKM machine gun in Uruzgan province. She had taken shrapnel that embedded itself in her ribs and left scars that looked like tribal tattoos. She had been made to disappear by the government she served, classified into non-existence because the operation in Marjah was never supposed to happen and she was never supposed to be there. But this small cruelty from a man in a white coat. This was somehow sharper. Understood, doctor, she said quietly. He was already walking away, already turning to the residents to discuss the next patient, already satisfied that he had established the necessary boundaries. But he turned back. One more thing. One more moment of theater. Actually, Katie, let me ask you something. He gestured for her to follow him to the vending machine in the break room. The resident stayed behind. This was between them now. Do you think you're qualified to question my clinical decisions? She stood in front of the vending machine. He was taller. He positioned himself so she had to look up at him. This was deliberate. Everything about this was deliberate. Katie had used the same techniques in interrogation training, positional dominance, environmental control, the strategic use of physical space to establish hierarchy. No, sir, she said. Because it seems like you do. His voice was lower now, meaner. The pleasant mask had slipped. This was the real voice underneath. Maybe if you spent less time playing doctor and more time changing bedpans, you'd remember your place. Katie stood very still. She did not flush. She did not look away. She did not clench her fists. Instead, she breathed. In through her nose. Out through her mouth. The way she had been taught in a facility that officially did not exist, by an instructor who had been erased, learning skills that she was not supposed to have. I need to get back to the floor, she said. Her voice was level. My patients. Of course, Dr. Whitfield said. Your patients. She left the break room and returned to the nurse's station. Her hands did not shake. Her breathing remained even. Her heart rate did not accelerate beyond the low 80 range. She was a professional. She had seen worse. She had survived worse. But that wasn't the worst part. The worst part came during evening rounds, 20 minutes later, when Dr. Whitfield reviewed the septic patient in bed 4. The man had been admitted 6 hours earlier with a fever of 103.8 and a blood pressure trending toward shock. Katie had already documented the clinical trajectory and flagged the lab values that concerned her. She watched as Dr. Whitfield reviewed the chart, watched as he ordered the antibiotic regimen, watched as he calculated the vancomycin dose out loud for the benefit of the residents. 17 milligrams per kilogram, he announced, writing the order. For a 90-kilogram patient, that's 1,530 milligrams per dose. Katie's breath caught. Just for a moment. The patient's renal function was compromised. The dose was 15% too high for someone whose creatinine was already trending upward. It wouldn't kill him. But it would damage him. It would add another insult to a body already in crisis. She looked at the residents. None of them questioned it. They simply wrote it down. Katie approached as Dr. Whitfield was finishing his notes. "Doctor, could I speak with you for a moment?" Her voice was soft, deferential. The voice of someone asking, not telling. "About the vancomycin dosing for bed 4. Dr. Whitfield's jaw tightened. "Yes?" "His creatinine is 1.8, trending up. For renal adjustment, I wonder if we should consider 13 milligrams per kilogram instead. That would be closer to 1,170 milligrams per dose." The room went quiet. Absolutely still. The fluorescent lights hummed their electric hymn. The ventilator in bed 2 wheezed its mechanical rhythm. And Dr. Whitfield's face went absolutely white with rage. "Are you questioning my clinical judgment?" he said quietly. Too quietly. "In front of my residents?" "No, sir. Because what I'm hearing is a nurse who thinks she knows more than a board-certified cardiologist about drug dosing." His voice had taken on a sharp edge, like metal dragging across glass. "Is that what's happening here, Katie?" She stood very still. She knew what was coming next. She had seen this pattern before, in other venues, with other men who had lost face in front of their subordinates. The escalation. The establishment of dominance. The weaponization of authority. "No, sir," she said. "Because I want to be very clear about something." He stepped closer. His voice dropped to a register that only she could hear, though everyone was listening. "If you ever question my orders again, if you ever contradict me in front of my residents or my patients or anyone else in this hospital, I will have security escort you out of this building and off this unit permanently. Do you understand me?" Katie's hands were steady. Her breathing was even. Her face was a mask of professional deference. "Understood, doctor." "Good. Now get back to your patients." She turned and walked away. Back to the nurse's station. Back to her charts. Back to the careful construction of invisibility that had become her life. The residents whispered among themselves. Dr. Whitfield made a note in the chart, the wrong dose, the dangerous dose, the dose that he had now doubled down on by establishing his authority through threat. Katie had 30 seconds of work to do before she could disappear. 30 seconds before she could lock herself in the supply closet and allow herself 3 shaking breaths. She made it to the back of the unit, to the supply closet where they kept the sterile drapes and the medication pouches and the emergency equipment that nobody wanted to think about. She closed the door. The fluorescent lights hummed here too, the same eternal hum of a hospital running through the night. She pressed her forehead against the cool metal shelf and breathed. In through her nose. Out through her mouth. 1, 2, 3. The trembling wasn't fear. It was restraint. It was the coiled energy of someone who knew exactly how easy it would be to make Dr. Whitfield understand his position. It was the terrible discipline of 17 years compressed into 3 shaking breaths in a supply closet in Atlanta, where nobody knew that the nurse in the scrubs had once been called something else, in a place that officially no longer existed. She composed herself and returned to the floor. At 1:12 a.m., she checked on the patient in bed 12 for the first time that shift. Captain Derek Morrison lay unconscious, his chest wrapped in surgical dressing, his left lung still not fully re-expanded from the trauma in Marjah. He was on supplemental oxygen, his heart rate steady, his monitors showing the electronic proof of a man recovering slowly from catastrophic injury. What Katie did not know, as she adjusted his feline and noted his vitals in the chart, was that this man had made a promise to bring her son home alive. She did not know that her boy, Ethan Morrison, who had joined the army at 18 and deployed with the 3rd Battalion, 5th Marines out of Camp Lejeune, had been under Captain Morrison's command. She did not know that when everything went sideways in Marjah, when the firefight erupted and the airstrike came in too close and 3 soldiers went down, it was Captain Derek Morrison who had pulled her son to safety, who had carried him for 2 kilometers under fire, who had gotten him on the helicopter that saved his life. She did not know any of this as she looked at his unconscious face. She saw only a patient. A recovering special operations soldier. Another person to add to her caseload, another life to monitor through the night, another heartbeat to keep safe in the darkness. But the universe had placed her in his room for a reason. And in 14 minutes, that reason would announce itself in the most catastrophic way possible. The morning light filtered through the ICU windows at 6:36 a.m., casting long shadows across the linoleum floor as Dr. Whitfield entered the conference room with 17 physicians, 9 residents, and 4 medical students clustered around the projection screen. His tailored charcoal suit caught the fluorescent overhead lights, the suit of a man who'd already scheduled lunch with the hospital's search committee for department chair. Katie stood against the back wall, arms crossed, watching the screen flicker to life. Her own chart notes appeared in 12-point font, magnified and damning under his careful hand. "Good morning, colleagues," Whitfield began, his voice carrying the practiced warmth of someone used to commanding rooms. "Today I want to discuss something critical, something that compromises every decision we make in this unit." He paused, letting the weight settle. "Common charting deficiencies. And I have a perfect example." Katie's hands clasped in front of her. She'd done this calculation 4 times. The dopamine dosage she'd documented for the septic patient in bed 7 was flagged as high, legitimately high, and she knew it. Her jaw tightened almost imperceptibly, but her breathing remained even, controlled, the kind of calm that comes from having already survived worse things than a cardiologist's pride. "Nurse Morrison here," Whitfield continued, circling her notes in red marker with the theatrical precision of a prosecutor building a case, "has documented, and I quote, concerns regarding sepsis protocol timing relative to antibiotic administration intervals." As if she's qualified to make clinical judgments about treatment protocols. He turned to face the gathered physicians. This is what happens when nursing staff overstep their scope. When they confuse observation with diagnosis. One of the senior residents, Dr. Hayes, shifted his weight uncomfortably. A first-year resident, barely old enough to legally drink, actually laughed, a thin sound that died quickly when Whitfield didn't acknowledge it. Katie didn't move. Didn't blink. Her eyes remained fixed on a point somewhere past Whitfield's left shoulder, her face the color of fresh plaster. The other nurses on the floor noticed. Marjah, who'd worked night shift with Katie for 3 years, made a small sound in her throat, half protest, half resignation. Everyone in that room understood what was happening. This wasn't about charting. This was about power. This was about a man who needed to be unquestionably right in front of the residents who would vote with him when the department chair campaign heated up. Her clinical scope, Whitfield continued, enjoying his audience now, is documentation and patient comfort. Not dosage calculations. Not questioning established protocols. He smiled at the residents, the smile of someone who'd successfully demonstrated his authority without raising his voice enough to be reprimanded. "When we see this kind of overreach, we correct it immediately. Professionally. But firmly." Katie returned to her station 30 seconds after the meeting disbanded. Her hands were steady as she resumed her charting. She pulled up the file for bed 7, verified the dopamine rate one more time, still high, still concerning, but she didn't add a single note. Her handwriting didn't waver. The other nurses watched her work in silence, the kind of silence that felt like collective held breath. But that wasn't the worst part. The worst part came at 3:15 p.m. during the shift change when Katie was standing at the vending machine, feeding a dollar bill into the slot for her 3rd coffee of the day. The machine hummed its mechanical song, and she heard his footsteps before she saw him, Whitfield's shoes clicking against the tile floor with the confidence of a man who'd just won something. "Still playing medic, Morrison." His voice came from directly behind her, accompanied by the rustle of 2 residents trying to look casual about following their attending physician to the break room. "Or should I call you Dr. Morrison?" Katie's hand paused on the coffee cup, one breath, no more, then continued its motion. She turned to face him, her expression absolutely neutral, her eyes the color of winter ice. "My apologies, Dr. Whitfield," she said, her voice perfectly level, stripped of anything that might be interpreted as defensive. "Tell me," he continued, sensing the advantage and pressing it the way sharks press bleeding water, "where exactly did you do your medical training? YouTube University?" One of the residents, the younger one who'd laughed, offered a weak chuckle. Whitfield's smile widened. Because your approach to patient assessment seems a little enthusiastic for a nurse. Katie pulled the coffee cup free from the machine. The plastic was warm against her palm. She met his eyes for exactly 2 seconds, a look so empty it seemed to drain color from the room, and said, "Excuse me, Dr. Whitfield," with the kind of politeness that was actually a closed door. She walked past him, her shoulders back, her gait steady as a metronome. Behind her, one of the residents whispered something. Whitfield laughed louder than necessary. Katie didn't head back to the unit immediately. She found the supply closet on the 3rd floor, the one nobody used because the light switch was broken and it smelled like industrial bleach and cardboard boxes. She pressed her forehead against the cool metal shelf, her breathing still controlled, still measured, but her hands were shaking now. 3 breaths. That's what she allowed herself. 1, 2, 3. Then she opened her eyes, straightened her shoulders, and walked back out into the corridor as if nothing had happened. The evening shift began at 7 p.m. Katie was assigned to the same 4 patients, including Captain Derek Morrison in bed 12. She checked on him every 90 minutes, more frequently than standard protocol required, but careful never to draw attention. She noted his vitals with the focus of someone reading a story written in numbers and waveforms: heart rate, blood pressure, oxygen saturation, core temperature. The data told her things. Pain is data. Temperature is data. The slight tremor in his left hand as the sedative wore off was data that suggested his nervous system was waking up, becoming aware again. At 9:43 p.m., during the quiet stretch of night shift when the hospital seemed to hold its breath between admissions, Katie heard the residents gossiping in the break room. She wasn't trying to listen, she was refilling the water pitcher from the cooler, but their voices carried through the thin walls like voices always do. "Did you see Whitfield destroy that nurse today?" one of them said. "Morrison or something?" "Absolutely brutal," another voice agreed. "I felt bad for her, honestly. But that's what happens when you get above your pay grade. She should know better. I mean, we're the doctors. She's just a nurse." The words hung in the air, suspended like antiseptic mist. Katie filled the pitcher. Her hands didn't shake. She returned to the unit, distributed the water to her patients, and continued her rounds as if the conversation had happened in a completely different hospital, in a completely different world, to a completely different person. But the words had ripples. By the time the 11 p.m. shift handoff arrived, 3 nurses had made pointed comments about respecting scope of practice. Someone had started a rumor that Katie was being watched for documentation errors. The charge nurse pulled her aside at midnight and said, quietly, "Maybe just keep your head down for a while, okay? Dr. Whitfield's in a mood." Katie nodded once. She didn't explain that she'd spent 14 years keeping her head down, that she'd built her entire civilian identity on the principle of being unremarkable, invisible, safe. That silence was her native language. Captain Morrison's monitor began alarming at 1:38 a.m. His heart rate climbed from 76 to 98 in 30 seconds. Katie was at his bedside before the second alarm sounded, her movements the smooth, economical gestures of someone who'd done this before, in places where there was no second chance, where the person in front of you was everything. She glanced at his surgical site. The dressing looked stable. His pressure held steady. "Captain Morrison," she said quietly, checking his full line, "You're okay. You're in Seattle General in Atlanta. You're safe." His eyes moved beneath his eyelids, REM sleep, the brain processing trauma, the body trying to heal itself. His hand twitched, reaching for something that wasn't there, fingers moving through an empty air as if clutching for a rifle that existed only in memory. Katie had seen this before. She recognized it the way you recognize your own reflection. She adjusted his sedation, confirmed his vitals were stable, and made a note in his chart. The alarm quieted. His breathing evened out. By 2:15 a.m., he was back into deeper sleep, his body finally trusting the safety his mind hadn't caught up to yet. Katie returned to the nursing station. She pulled up the medication log for bed 7 again, verifying the dopamine rate one last time. High. Still high. If she documented her concerns again, Whitfield would escalate. She understood the calculus now. She understood that speaking up had a price, and the price came due in humiliation, in whispers, in being marked as difficult, as someone who didn't understand hierarchy, who didn't know her place. She closed the file without adding a note. At 3:27 a.m., the ICU was as quiet as a hospital ever gets, the ventilators keeping their steady rhythm, the monitors their persistent beeping, the fluorescent lights their overhead hum that sounds like nothing and everything all at once. Katie sat at her station, charting, and she reached down to touch the worn leather of her combat boots under the desk. Just a small movement. Just a reminder. The quietest person in the room might be holding it all together. She was holding it together. She was holding Captain Morrison together. She was holding her son's unspoken promises together. And somewhere in the next few hours, she had no idea, all of it was about to come apart. The night shift moved like a held breath. 2 a.m. at Seattle General in Atlanta meant skeleton crew, 3 nurses covering the entire ICU, monitors beeping their steady rhythm, the ventilator in bed 12 offering its mechanical song. Katie had rotated past Captain Morrison's room 6 times since midnight, the routine checks consuming her attention with the same precision she'd learned in field hospitals where one missed detail meant someone's son didn't come home. His sternotomy incision was healing cleanly, the surgical site red but stable, sutures holding firm. She documented every change in careful handwriting, evidence of work performed with absolute competence, the kind of charting that would never invite questions. Until his eyes opened. Not the reflexive flutter of a sedated patient. Not the confused searching of someone swimming up from anesthesia. He opened his eyes fully conscious, focused, and found her face immediately as she adjusted his full line. Recognition moved through his expression like a light switch flipping on. "You're Ethan's mom, aren't you?" His voice was rough from the breathing tube, but the certainty in it was absolute. "He talks about you constantly." Katie's hand stilled for exactly 1 second. Just one. Then she resumed her work as if the question had been nothing, a routine inquiry about his bandage, his pain level, the standard ICU interrogative. But her mind had shifted into a different gear, the kind that had once run convoy routes through Helmand Province, that had calculated ballistics and survival odds in the spaces between heartbeats. Captain Derek Morrison. The man who had promised to bring her son home alive after the operation in Marjah went sideways, after everything got classified and Katie got erased, after Ethan came back with haunted eyes and a medal and a silence about what his unit had really done there. Morrison lay in front of her now, post-operative from emergency thoracic surgery, his presence suddenly taking on a weight that had nothing to do with his vital signs. "You're healing well," she said quietly. Neutral. Professional. Not confirming, not denying. Just facts. She checked his oxygen saturation, 96%, excellent, and made a note on his chart. The fluorescent lights hummed their clinical song above them. Outside his window, Atlanta slept under October darkness, indifferent to the small revelation occurring in this sealed room. "Ethan said you were." Morrison paused, struggling with the effort of speaking, his chest rising carefully beneath the monitoring leads. "He said you weren't around anymore. That you'd had to leave." Katie adjusted the dressing around his sternotomy incision with practiced gentleness, unwrapping the gauze to inspect the surgical line. The sutures were perfect. The site was clean. Everything was healing exactly as it should. She said nothing because there was nothing to say, not here, not now, not to a special forces officer who understood classified better than most, who would recognize the shape of an erasure when he saw one. Instead she focused on the technical work. The dressing change was routine, one she'd performed hundreds of times. Sterile technique. Gentle handling of the incision. New gauze, clean tape, the methodical dance of someone who had kept people alive in conditions that made this climate-controlled hospital feel like a luxury resort. That was when she felt it. A sudden give. A moment of resistance followed by a soft tearing sensation. The sternotomy incision didn't rupture, it exploded. One moment Katie's hands were performing routine maintenance on a healing surgical site, the next she was watching the sutures give way in a cascade of failure, the incision opening like a mouth gasping for air. Blood welled up immediately, dark and arterial, and behind it she could see the terrible truth: the pericardium was breached, the heart sac itself torn open, and Captain Morrison's monitor went absolutely berserk. VFib. Ventricular fibrillation. The heart in chaos, electrical storms firing at random, the rhythm that meant death in minutes if nothing changed. The alarm screamed. 3 of them at once, high-pitched and relentless. Katie didn't hesitate. Didn't reach for the call bell. Didn't wait for Dr. Whitfield or permission or any form of authorization. She snapped orders to the resident who was already moving toward the door, her voice dropping 2 octaves, becoming something else entirely, something that had once directed teams under fire, that had made people move because the alternative was bodies in bags. Get the crash cart. Grab a size 4.0 endotracheal tube and a 14-gauge angiocath. Now. The resident ran. Katie's hands were already moving, already assessing. She could see Morrison's chest. Could see the bleeding. Could see the window that was closing by the second, and she made the only decision that mattered. She reached in with both hands and cracked the sternotomy wider, spreading the ribs herself, feeling them give beneath her palms like a door opening. Her hands moved like they belonged to someone else, someone who had done this before in the dust outside Marjah, where there was no crash cart, no attending physician, no sterile operating room, just the certainty that if she didn't keep his heart beating manually, nobody would. Direct cardiac massage. Fingers closing around the ventricle itself, feeling it fibrillate and die in her grip, and she began the rhythm, compressions that should have been impossible, that should have required years of training and official licensure and a board of directors' approval. Her hands had simply remembered. Muscle memory was a mercy and a curse, and Katie's muscles remembered everything. 60 compressions per minute. Smooth. Controlled. Precise. The kind of precision that came from having already survived the worst, from understanding that hesitation was a luxury dead people indulged in. Epi, 1 milligram 4 push, she said to the nurse who'd appeared at the code, who was staring at the sight of a floor nurse with both hands inside a patient's open chest cavity. The nurse didn't move, frozen by the sheer violation of protocol. Katie's voice cut through the hesitation like a blade. Push it. Now. The nurse moved. The medication went in. Katie continued the compressions, feeling the heart respond beneath her fingers, that terrible flutter beginning to regularize, beginning to remember what it was supposed to do. The monitors started changing. The chaotic lines on the screen began to settle. The electrical storm in Morrison's heart started to become something readable, something salvageable. 60 compressions. 70. 80. Katie's arms burned with a familiar fire, but her hands never wavered, never slowed, never acknowledged the pain as anything other than data, information that the system was working, that the blood was moving, that the man in the bed was still alive because she had made it so. Sinus rhythm. A stable beat. A coherent, beautiful, organized sinus rhythm appearing on the monitor like a prayer answered. Katie maintained the compressions for another 10 seconds to ensure stability, then slowly withdrew her hands. Blood covered them to the wrists, warm and real. Morrison's chest rose and fell with the ventilator. His oxygen saturation was climbing, 88%, then 92, then 96. His blood pressure was 118/74. Stable. Alive. Not dead in a way that would have been Katie's fault, though everyone would have found a reason to make it so. The alarm stopped their frantic screaming. The resident returned with the crash cart, its arrival suddenly unnecessary. The room fell into the shocked silence of a crisis averted, of death held at arm's length by someone nobody had expected to be capable of such a thing. Katie was already moving to assess the incision itself, already cataloguing the bleeding site, already planning the information she would need to convey to whoever showed up next to take over. The door slammed open. Dr. Whitfield stood in the entrance, and the moment he processed what he was seeing, Katie's hand still red with blood, the cracked sternotomy, the patient's chest open in a way that no floor nurse should ever be responsible for. His entire face went white. Then it went crimson. His hands clenched into fists at his sides, and Katie watched the rage build in him like a pressure system moving inland, destructive and inevitable. "What the hell do you think you're doing?" he roared. The words echoed off the ICU walls, and every head at every station turned toward the sound. Katie didn't rush her response. She was already assessing Morrison's rhythm one more time, confirming his vitals, ensuring he wouldn't collapse the moment she looked away. When she finally spoke, her voice came out completely flat, completely clinical. His sternotomy ruptured. He went into V-fib. I performed direct cardiac massage and achieved return of spontaneous circulation. He's stable now. Whitfield turned to the resident, his entire body vibrating with fury. "You let a nurse crack this patient's chest open." The resident stammered something about the emergency, about Katie saying there wasn't time, but Whitfield wasn't listening. He was examining Morrison with the quick, angry hands of a man who wanted to find something wrong, wanted to justify his rage with some piece of medical evidence that Katie had damaged the patient further. But the vitals were good. The rhythm was stable. The hemorrhage was beginning to slow. Everything Katie had done had been exactly right, which seemed to make Whitfield's fury burn hotter rather than cooler, the way a fire burns fiercer when it's being denied oxygen. "Out," he said to Katie, his voice dropping to something quieter and somehow more dangerous. "Now." Katie stripped off her gloves with mechanical precision, disposing of them in the biohazard container. She didn't argue. Didn't explain. Didn't offer any of the justifications that might have made sense to someone who understood what it meant to keep someone alive when the official procedures said they should be dead. She simply left, moving past Whitfield with her shoulders level and her eyes forward, the way someone moves past a predator they've already assessed and decided wasn't worth fighting. What happened next would be the beginning of the end, though Katie didn't know it yet as she walked to the nursing station and began charting her notes with the same careful documentation that had kept her alive through classified operations. Whitfield pulled out his phone in the hallway, and she could hear his voice through the half-closed door, tight with rage, clipped with authority, already calling in favors and burning bridges. "I need you to call the hospital president. Tonight." "Yes, I know what time it is. We have a liability situation. A nurse just performed a surgical procedure without supervision. I need an emergency ethics investigation launched within 48 hours, or I walk from the department chair candidacy entirely." She didn't hear the president's response, but she heard Whitfield hang up and immediately dial again. Dr. Whitfield arrived 4 minutes into the code, his polished shoes striking the ICU tile with the precision of a metronome counting down to something catastrophic. He stopped in the doorway of bed 12 and his entire body went rigid. Katie Morrison stood elbow-deep in Captain Morrison's open chest cavity, her hands performing direct cardiac massage with the steady rhythm of someone who'd done this before, not in a simulation lab, but under mortar fire with the walls shaking around her. Her compressions were textbook perfect. The surgical field was clean. The resident beside her was calling out vitals with the practiced cadence of someone following a master. For 1/2 second, Dr. Whitfield's face drained of color as he took in the scene. Then it flooded crimson. "What the hell do you think you're doing?" His voice cut through the room like a surgical blade, sharp enough to draw blood from anyone with a conscience. Katie didn't flinch. She didn't pause. She completed her compression sequence, 1, 2, 3, 4, before stepping back with the measured precision of a soldier yielding ground. No argument. No explanation. No defensive posture. She simply released the chest retractor and moved aside, her hands dropping to her sides, still steady. Whitfield shoved into the gap she'd vacated, his movements aggressive where hers had been controlled. But he was competent, Katie would give him that much. His hands moved into position. He assessed the surgical field. He barked orders at the resident with the efficiency of someone who'd performed this exact procedure 100 times. Within 3 minutes, Captain Morrison's heart began responding. The monitor shifted from the flat line of asystole to the organized blip of sinus rhythm. The color started returning to Morrison's face. Whitfield had saved his life. And now he was going to destroy hers. Katie moved to the corner of the ICU, peeling off her surgical gloves, her face showing nothing. But she watched. She always watched. She'd learned in Kandahar that people revealed their true intentions in the moments after crisis, when adrenaline loosened the filters. Whitfield was already on his phone before Captain Morrison's oxygen saturation climbed past 85%. She couldn't hear the words, but she knew exactly what he was saying by the way his jaw worked, by the rigid line of his shoulders, by the glance he threw her that carried the weight of a promise to burn everything she'd built. The phone call to the hospital president took 4 minutes. Whitfield paced the ICU hallway, his voice modulated just enough that it wouldn't disturb the other patients, but pitched so that every nurse within 20 feet could hear the threat underneath. "We have a serious regulatory violation. One of our nursing staff attempted a surgical procedure without authorization. I need immediate escalation to administration." The president's response was inaudible, but Whitfield's smile was the kind a shark wore when it sensed blood in the water. Within 40 minutes, Whitfield had activated board members. Katie learned this when the hospital's chief nursing officer appeared at the ICU desk with an expression that suggested she was carrying news from a funeral. "Katie, Dr. Whitfield has asked that we initiate a review process regarding your actions during the emergency," she said carefully. Professional. Non-accusatory. Which meant the machinery was already in motion. The review process didn't just appear. The board members didn't just suddenly converge without someone pulling very specific strings. Whitfield had made 3 calls to Katie's nursing school references by noon. She found out when the school's dean called her directly. "We received some inquiries about your credentials and performance history," the dean said, his tone shifting from cordial to cautious. "I assured them you were an exemplary student, but I wanted you to know there are questions being raised about your judgment under pressure." The message was clear. Whitfield was building a narrative. He was laying groundwork. He was constructing a case that would hold up when it mattered. By 1 o'clock, Dr. Whitfield had personally selected an outside ethics consultant and activated a formal investigation. The consultant was a cardiologist from another hospital system, not someone Katie knew, which meant Whitfield had specifically chosen someone with no prior relationship to her, no reason to extend any professional courtesy. The ethics investigation was launched with the speed of something that had been pre-planned, like Whitfield had been waiting for exactly this kind of justification to move forward with a campaign he'd already envisioned. Katie's badge was deactivated at 1:48 p.m. The notification came through the hospital's security system. She tried to swipe her card to enter the staff lounge and it rejected her, a harsh electronic buzzer that felt like a door slamming. She didn't swipe again. She didn't make a scene. She simply walked away and returned to her station for the last time, moving between beds to hand off her patients to the evening shift with the composure of someone clocking out of a regular day. "Locker inspection scheduled for end of shift," the chief nursing officer told her quietly. Not a question. Not a suggestion. A procedure that was already in motion. Katie nodded and finished her charting. Around her, the ICU hummed with the sounds of monitored life, ventilators whooshing, cardiac monitors beeping their steady rhythm, the soft patter of 4 drips counting down. The normalcy of it felt obscene. Everything was continuing exactly as it always had, and her world was collapsing in real time. She made it to the parking garage at 6:23 p.m. Her car sat in space 47B, exactly where she'd left it that morning when she'd driven in thinking she was just going to work another night shift, another invisible rotation as just another nurse. The grey light of early evening filtered through the concrete pillars overhead, casting everything in shades of ash and shadow. Katie got in, closed the door, and gripped the steering wheel with both hands. The key was in her pocket. She knew exactly where it was. But she couldn't make herself reach for it. She sat there with her forehead pressed against the steering wheel, her breathing steady and controlled because panic was a luxury she'd trained out of herself years ago, but her hands wouldn't let go. The classified operation in Marjah had taken everything from her, her career, her official identity, her existence in any database that mattered. The military had erased her. They'd removed her from every record, officially killed her, made her a ghost in a uniform that no longer existed. She'd rebuilt from that erasure. It had taken 3 years of underground living, fake documentation, contact with handlers who existed only as voice on encrypted phones. She'd become Katie Morrison, civilian nurse. She'd created this identity from nothing. She'd gone to school, earned her credentials, survived 6 years of keeping her head down and her mouth shut. She'd built a cover so complete that she'd almost believed it herself. And in the time it took for a captain to go into cardiac arrest and Katie to keep him alive, it had all disintegrated. The cover identity that had taken her a decade to construct was coming apart at the seams now. The ethics investigation would find inconsistencies in her background documentation. The board members would question her judgment. The consultant would recommend her license be revoked. She couldn't fight it, not without revealing exactly who she really was, and revealing that would compromise the entire operation, would expose the men and women who'd worked with her in Marjah, would cascade through classified files like a demolition charge. Katie sat in that car for 47 minutes. The windows fogged up from her breathing. Her hands gradually released their grip on the wheel, dropping to her lap. Around her, other hospital staff came and went, clicking remote locks, starting engines, driving away to homes and families and lives that had continuity. She remained motionless. A security guard tapped on her window at 7:14 p.m., his face showing concern through the glass. "You need medical assistance." Katie shook her head slowly and started the engine. She drove back to her apartment on Chambly Road, the same apartment she'd rented for 6 years, sparsely furnished, decorated with nothing that could identify her, ready at all times to be abandoned if the assignment required it. She climbed the stairs to the second floor and locked herself inside. The walls were plain beige. The kitchen had the feeling of a place where someone merely heated food, never really cooked. The bedroom held a bed and nothing else. The only personal item she owned was a pair of worn combat boots sitting in the hall closet, covered in dust from a mission that officially never happened, in a country that had officially never seen her. She took them out now and set them on the coffee table, staring at them like they were evidence from a crime scene. The leather was cracked. The soles were worn through in places. The left heel had been scraped raw by shrapnel during extraction. She'd kept them because you didn't dispose of pieces of yourself, even when you were supposed to stop existing. Her phone buzzed with messages she didn't read. Her son. Captain Morrison's hospital extension. Numbers she didn't recognize. All of them were gravity wells trying to pull her toward conversations she couldn't have, explanations she couldn't provide, a truth that would burn everything if it surfaced. Katie sat in her apartment as evening deepened into night, the combat boots on the table in front of her, and allowed herself exactly one thought: maybe she should have just let herself stay buried. The hospital lobby television was showing the evening news when the broadcast cut to a Pentagon press conference, and Dr. Whitfield froze in the administrative hallway, his phone still pressed to his ear. His call to the hospital president cut to silence. The screen shifted to a PowerPoint slide, newly declassified operations, a voice said, from 2010 through 2015. Special Forces deployments in Helmand Province. Katie's photograph filled the screen. 20 years younger. Full combat gear. M16 across her chest. The caption read, Master Chief Petty Officer K. Morrison, missing decorated combat medic. Dr. Whitfield's coffee cup slipped from his hand. It shattered across the tile floor, the sound like breaking glass underwater. His face went the color of surgical gauze. Nobody moved. The hospital staff gathered in the lobby stood absolutely still, watching the screen, watching his face, watching the moment his world began to collapse like a building in controlled demolition. The news anchor continued, in a historic acknowledgement. The Department of Defense has declassified the identity of a Navy combat medic who was listed as missing and presumed deceased during Operation Enduring Freedom. Master Chief Petty Officer Katie Morrison survived her classified mission in Marjah and has been living under civil cover for the past 18 years. The press conference showed a retired general at a podium, reading a single paragraph before closing the briefing. No further questions. That was when Captain Morrison limped through the lobby doors on crutches, moving with the careful deliberation of a man whose lung had been reassembled 6 days ago, who should not have been released from ICU at all, who had checked himself out against medical advice at 6 a.m. He was still wearing the hospital band on his wrist. His face was the color of fresh concrete. He walked directly toward the administrative offices where the hearing was supposed to begin, the hearing where they were going to discuss Katie Morrison's permanent license revocation, her termination for cause, her removal from the nursing register. The administrator's assistant tried to intercept him. "Sir, you need to check in," Captain Morrison's voice cut through the lobby like a blade. "Where's the hearing?" A resident who'd worked with Katie pointed. Morrison didn't acknowledge the gesture. He just kept moving. His crutches made a rhythm on the tile, tap, drag, like a heartbeat that was refusing to quit. When he entered the conference room where Dr. Whitfield was sitting across from the hospital president, 3 board members, and the ethics consultant Whitfield had hired, nobody spoke. Morrison stood in the doorway for 3 seconds. That was all it took. "The woman you're firing," Morrison said. His voice had the weight of someone used to being listened to. Her call sign was Phantom. She was my platoon medic during Operation Badger Bite in Helmand Province in 2010. He didn't sit down. He remained standing on his crutches, still wearing the hospital gown under a borrowed Navy windbreaker. You want to know why her hands moved like she'd done an open chest massage before? Because she had. 47 times. In a field hospital under mortar fire. In Marjah, when my entire unit got hit by IED shrapnel, she was the one who kept us breathing until the Blackhawks came in. Morrison looked directly at Dr. Whitfield. She took fragmentation wounds meant for my entire unit. They made her disappear because she was never supposed to be there in the first place. The room held a silence so thick you could have sutured in it. The hospital president's expression shifted from defensive to something else, something that looked like recognition, or horror, or maybe both at once. The elderly security guard at the door, a man named Harrison who'd served as a corpsman in the Navy Reserve for 32 years, snapped to attention with the kind of reflex that doesn't fade. His voice came out like a salute, "Master Chief on deck." 20 people in that hallway heard it. By 3 p.m., 500 people in the hospital knew. By 6 p.m., 3,000 people across Atlanta knew. By 9 p.m., the story had reached the news networks again, but this time it was different. The networks weren't reporting a missing medic anymore. They were reporting a vindication. The 2-star general who'd flown in from Fort Bragg, General Robert Peterson, who'd commanded Task Force 121 during Katie's deployment, walked into the hearing with a folder thick as a textbook. He sat at the head of the table and opened it without being invited to speak. His voice carried the same quality as Morrison's, the kind of voice that had ordered men into combat, that had signed casualty reports, that had the authority to reshape the entire room just by choosing to speak in it. He read Katie Morrison's citation record for 47 minutes. Not the civilian Katie. The real Katie. Master Chief Petty Officer Catherine Eleanor Morrison, Service Number 78-0401 NM, SEAL Team 3 Charlie Platoon, deployed to Helmand Province March 2010 through November 2010, extended through August 2011. Bronze Star. The General paused. Let the weight of it settle. Silver Star. Another pause. The board members were already understanding what this meant, that Katie wasn't some overambitious nurse who'd violated protocol. She was exactly what Dr. Whitfield had been too blind to see. 2 Purple Hearts. The general's voice didn't change inflection, but the room's temperature dropped 10 degrees with each medal. And a Navy Cross. That one the general read twice. Awarded for actions in Marjah that resulted in the survival of 17 members of her unit who would otherwise have been classified as expectant. Expectant meant impossible to save. Dead on arrival. But Katie Morrison didn't believe in dead on arrival. Captain Morrison spoke again, his voice very quiet in the silence after the general finished. She took shrapnel meant for my entire unit in Marjah. They made her disappear because she was never supposed to be there in the first place. He wasn't repeating himself. He was making sure everyone understood that the woman they were trying to destroy wasn't just a nurse with questions. She was a war hero they'd never even been told about. She was a classified asset who'd chosen to work night shifts in a hospital ICU instead of sitting on a board. She was the quiet competence they'd been punishing for daring to be better at her job than they were. The hospital president stood up slowly. He looked at Dr. Whitfield for exactly 5 seconds, the kind of look that precedes institutional destruction. "Dr. Whitfield, I'm going to ask you to step outside." But before Whitfield could move, General Peterson's voice stopped him cold. "I think the FBI would like a word first." 2 special agents in charcoal suits emerged from the hallway like they'd been waiting for their cue, because they had been. They'd been standing outside the conference room door for the entire hearing. The lead agent opened a tablet and scrolled to a series of email logs. "Dr. Leonard Whitfield, we need to ask you about attempted falsification of personnel records at Seattle General Hospital." The blood drained from Whitfield's face so completely he looked like he was made of ash. "At 6:24 a.m. on March 14th, the morning of Ms. Morrison's suspension, you accessed the hospital personnel database with your administrative credentials and attempted to alter her employment file." The agent's voice was precise, almost bored, the voice of someone who had done this hundreds of times before. "You added retroactive disciplinary notices and fabricated performance reviews designed to justify termination for cause." The hospital's IT director, who'd already flagged the suspicious access logs that morning, was called in to confirm the timeline. The entries were backdated. The approval workflows had been bypassed. Whitfield had created false documentation claiming Katie had endangered patients in March, before she'd even been hired. He'd manufactured a history that didn't exist, trying to build a house of cards that would collapse the moment anyone checked the actual dates. The ethics consultant Whitfield had personally hired quietly closed his laptop, gathered his briefcase, and excused himself without making eye contact with anyone. The board members were suddenly receiving urgent texts, remembering meetings they'd forgotten, finding reasons to leave the room. One of them stood up and walked out. Then another. The president remained, watching Whitfield with an expression that had shifted from shock to something far colder: fury at the betrayal, disgust at the manipulation, recognition that the man across the table had tried to use him as a tool to destroy an innocent person. Whitfield tried to salvage something, anything. She violated protocol. She performed a surgical procedure without proper authorization. His voice cracked on the word authorization. Captain Morrison, still balanced on his crutches, looked at the chief nursing officer. She'd already anticipated the question. She pulled out the hospital's emergency protocol manual and flipped to page 14, the section on advanced emergency interventions in critical situations where physician response time exceeded the critical window for patient survival. Direct cardiac massage is within scope for senior nursing staff when a physician response time would result in death, she read aloud. Page 14. She followed protocol exactly. You're the one who violated policy by not having an updated manual in your hands during your own sabotage investigation. The room went so quiet the fluorescent lights hummed like surgical saws. The FBI agents moved forward. Handcuffs clinked, a sound like dog tags, like keys, like the beginning of consequences. "Dr. Leonard Whitfield, you're under arrest for document fraud and obstruction of justice related to personnel records." They read him his rights in a corridor full of hospital staff. Residents. Nurses. Attendings. The physicians who'd stood silently watching him humiliate Katie at grand rounds. The nurses who'd heard him mock her at the vending machine. All of them watching now as he was walked out through the lobby in cuffs, the agents on either side of him like escort guards, like handlers, like the people who take away the things that were never supposed to belong to him in the first place. By evening, every local news station had run the story. By the next morning, it had gone national. By the end of the week, the hospital had issued a formal apology to Katie Morrison, full reinstatement to her position, immediate promotion to clinical director of emergency medicine, and back pay for all wages lost during the suspension. The hospital system also announced that all protocols would be revised to include Katie's name as a co-author, a living recognition that the quiet night shift nurse had been right all along, and they should have listened. Katie Morrison received a thick cream envelope marked official White House correspondence 6 weeks later. A presidential invitation to a Medal of Honor ceremony. The combat boots that had sat on her apartment table, the one she'd thought she'd have to carry alone forever, now sat on a shelf in her new office at the actual Seattle General, not the Atlanta campus, a new position created specifically for her. Next to them in a photograph frame was her son, home safe from his second deployment, polishing those same boots in her living room, finally understanding why his mother had always kept them close. The quietest person in the room might just be holding it all together. If Katie Morrison's story resonates with you, if you've ever been underestimated or pushed down by someone who didn't know who you really were, subscribe to this channel and hit the notification bell. We have more stories of hidden strength, of quiet warriors, and of systems that finally recognized what they should never have doubted. Like this video, comment below with your own story, and share this with someone who needs to remember that the person next to them might be carrying more than anyone knows. Thank you for listening to Katie Morrison's story. We'll see you next time.